Hello and welcome to the C229 CKA Task write-up video. This video is specifically for students in unregulated states. If you are a California student, the requirements are basically the same, but the rubric lettering is a little bit different and the time log requirements are also slightly different, but you're welcome to watch this video as well. So if you're to this point, congratulations on completing your field work. If you have not completed your fieldwork yet, you may as well go ahead and keep watching to see what the requirements will be when you get to this endpoint. In order to see if you're ready for the write-up, have you completed your 90 hours? Have you determined what the community gap is related to your topic? And have you discussed a potential action plan with partners in the community to make that plan as realistic as possible? Section A is the time log. Be sure you've used the time log in task stream. You'll notice that 25 hours are pre-populated. The remaining 65 hours should have a detailed description of the activity, including contact information. Make sure you have an address or a phone number as well as a contact name. You'll also include your signature. It can be handwritten or typed, your RN license number and state, and the date. And your signature indicates that you did complete the time log activities as you have outlined. Section B1 is the assessment. This is where you'll be able to use information from the theory course, task 1, so C228, SCT, or HAT, depending on which course you took. You will need to rewrite it to fit this task. You definitely don't need to include all of the information, but a lot of the data is applicable, and if you completed C228, you completed the windshield survey in there as well, which will be needed. B2 is the health concern, and this comes from the information you gathered in week 1 of the course. If you need to go back to the course's study week 1 to see what questions are asked there and helping you to describe that health concern. B3 is the target population. So what specific population do you plan on reaching out to in your action plan? Through your field work, which population did you identify as needing interventions? In this section, you'll also be identifying a health disparity within the community related to the topic. You will need to provide data to back that up, and if needed, you can refer back to your Stanhope e-text on what a health disparity is. B4 are the community resources and partners. This is where you're really going to describe your field work. You're going to describe those resources and partners that you connected with and discuss what services they provide in relation to your topic. Most often this is the longest part of a student's paper because they're really discussing what they did for those 65 hours. B5, the aspects not being addressed. So based on the field work that you've done, all of those interviews, what have you determined to be the systems level gap? So in B4, you've identified all of the partners and all of the amazing things that they're doing in regards to your topic. So why is it still a problem in your community? This is what you'll be addressing for the remainder of the paper. So you're really taking the nursing process and applying it at the population level. You've done the assessment, and now this is where you're going to do the diagnosis and then come up with your goals and interventions and a timeline and evaluation to really round out that nursing process. Section C is the outcomes identification, where you're going to give the overall goal to improve the health concern. You will definitely want to use Healthy People 2020 as you are developing your overall goal to make sure your goal is in line with national standards. Section D is the planning section. Here's where you'll create objectives, which are the mini goals, and nursing interventions, which will help you lead to those objectives. So objectives could be creation of some sort of program or policy, some sort of change within the community. And the nursing interventions are all of the activities that you or a team of nurses will need to do to help you reach those objectives. You will use the Minnesota Intervention Wheel in helping you develop those interventions. And many students ask if they need to use every element on the Minnesota Intervention Wheel, and no, you do not. You're just using what is applicable to you and your plan. And before you start the section, you may wish to review chapters 11, 12, and 16 of the e-text to get a good overview on program planning and education within the community. You have the partnerships section. So what partners are you going to need to create in order to reach your objectives and put your plan into place? Unfortunately, nurses can't do it alone. So within the community, we partner with various organizations and key leaders in order to get things done. So who will you partner with and what can they bring to the table when it comes to your plan? And for the timeline, when would you plan on doing specific interventions? When would you plan on reaching your objectives, and when would you expect results? And when we're talking population health, we're talking in months to years. So in 1 month, you plan on doing this activity. Within 3 months, you plan on doing this. Within 1 year, you plan on having a certain program in place. And within 5 years, you plan on seeing results. Something along those lines. Section E is the evaluation section. So how are you going to evaluate whether or not your plan was effective? Remember that it must be measurable. So what tools could you use to help in this evaluation? Could it be some sort of survey or a BMI? Those are just a couple of ideas to help you get thinking along lines of tools. For F, this is the conclusion section. Prior to the field experience, what did you think was being done at the national, state, and local levels in regards to your topic? And then you did your field work, so what did you learn was actually being done? So you're going to want to describe how your perspective and how that thought process changed from before doing your field work versus after doing your field work. Section G is the appendices. Many students will include a map of their community, and that really helps show the evaluator where you're coming from and kind of gives them that visual. You can also include graphs or charts that illustrate the health concern. Those are just a few ideas. You may come up with others that might be effective in giving the evaluator more knowledge related to your community. So if you still have questions, be sure and email us at chnursing@wgu.edu. And if your paper comes back for revisions, reach out to us and we'll make sure and get you on the right track for your resubmission. Thank you, and I hope you have a great day.